So, on my count, we have 12 minutes to get some reflections from the floor on what you learned, what you discussed. So, I heard a lot of activity, but is there anyone who wants to start? Otherwise, I can go table by table. But any groups that want to start? All right, I can go table by table. All right, let's start off with, I heard a lot of activity over there, and you guys were the last to sit down. So I think that was table 5 or 6? 7? All right. So any learnings, John, anything you want to? Okay. Wow. All right, I see. Breakout. All right, so Megan volunteered if no one volunteered to help break the ice. So is Megan here? All right, Megan.
All right. Well, we're all back at different tables, so I think it's just a little bit of the Wild West. So I'm just going to speak to our policy session. I was the facilitator, so I'm a biased observer. But one of the things that struck me came from the group talking about using the lessons we've learned in patient safety and really starting to apply them to well-being, with an example coming from Simon in the UK, where there's grown a parallel culture saying never events that exist in patient safety should exist in the training culture. What's a never event in training? A suicide would be a never event. What's a near miss? What does it look like? Are we calling these out? How do we identify them? How do we take all that we've learned in developing a just culture and apply it into our well-being culture?
Fantastic. And I think I was sort of going in and out of the groups, and I think, Megan, in your group, I heard that university student was in the group that testified about receiving a phone call at 2 a.m., and she got the call because there's a student government president and so it was unclear who to turn to in that setting, which is actually an organizational issue. Anyone else, or I can keep going by working groups, but I'd love to hear other thoughts. Yeah, Susan, please.
See if I can get this close enough. Well, one of the things that actually came from several groups when we just had our last quick conversation was that we've had in these sessions, at least the ones that were represented, really good case studies and really illuminating kind of deep case studies. But we didn't tackle, and we need to as a group, the harder question of scaling up. And the harder question, Mary Jo, you put it well. You said you learned that there may be policies in place which are ignored. So it's scaling up, but it's also even working with what's already theoretically in place, but is not part of the culture, or is not really a norm, or the leadership is not following through.
Love it. Excellent. Yes, let's go back to table 8.
I had sort of an aha moment that went from this morning to this afternoon, and the people that I was talking to might want to add to this, but I work disaster relief. And when you are on disaster relief teams, you're always taking care of each other. So, even down to I haven't seen you have a drink of water, so in like 3 hours, so here you need to have a drink. And we take care of each other. And there's usually always a psychologist available that gets sent along with those teams because everybody's stressed. And as we were talking, I realized that we don't do that for anybody in the hospitals or in any of the workplaces, really, where there's just somebody to be able to talk to. And in our group, I was in the systems approach, and we did talk a little bit about the employee assistance programs where you have counselors that people can go talk to, and sometimes those sessions are free. And so it was just an aha moment for me, and one of the people I was talking with said, well, why don't they do that? And I presume it's either because we didn't think of it, or it costs too much money, or, we just didn't think of it.
Excellent. Might call on, is it Mariana? I walked in, and it was a wonderful extension of the mind-body program. So do you mind just debriefing what happened in your group? And if anyone else in her group had an aha moment? Okay, I see John looking at me. Perfect, okay.
Well, I was just happy nobody fell off the tables as we were trying to transfer the patients. So that was a huge success. And I just think everybody in the room can relate to how important it is to have an environment that supports health and well-being. So the question is, what are the factors that need to be in place, and how can we work at the edges to create those things?
So I just have to say, the visual that I had walking into the room, I walked in, everybody's eyes were dead closed, arms were like this, and people were like, and I have to say, there were deans, former deans, students, all in the same room. And I just want to honor the internal consistency that's in this group. A lot of people talk about this stuff. But to walk into a room and see people hungover like this, but walking the talk from what you were doing, it was really impressive. So I just wanted to say thank you. Let's go back to table 6.
So to
And then
call
John, I'll
out
come to you.
something that, so I was in that session. My shoulders are feeling so good. But what I actually wanted to call out even more importantly is that, so they do this, I'm not going to go through the whole thing, but I think what is really unique and special about this is for the RRT students, so very early on in their experience, as they are priming up to get into the clinical world, learning how to do it, this, mind-body thing that they do for 5 minutes actually has 3 incredibly core messages that came from the top, which is ask for help, which is to keep you from getting hurt. Focus on your patient, and this is specific things to do. Visualize looking at them, talking to them, communicating with them. So those are already 2 of our core take care of yourself things, all incorporated in this one experience. So to me, the fact that they really had 3 competencies rolled up into this single event that then she makes them really incorporate, because then they have to teach it, is just an extraordinary efficient combination of showing that this isn't something extra, it's part of the core of what we need to do, and that is actually exemplary.
I see hand, yeah.
So I was in the same session. I wanted to add to that in terms of something Kathy McGuinn said, I don't know where Kathy is, about the power of learners, of students. And so you talked about scaling up at this table, and I wonder about spreading across and innovating across both practice and education, but remembering that between practice and education, there's a practice education system when our learners are actually in the workplace. And so that very powerful 5-minute thing, what I would be curious about is when preceptors and clinicians are watching students prepare for their clinical rotations in taking 5 minutes to breathe and think about their patient and imagine the next imaging technique, what happens for the staff, for the clinical environment? Because we often hear in our own environment in Toronto, how do we get what the students are getting? Why don't we have what the students have? And so I think to that idea of students are powerful change agents, whether they're intentionally trying to make change, I think by modeling some of this, something I think that we need to think about.
Fantastic. John, I'll go over to you.
Yeah, I was a 3, but I was in that group. What struck me was that this system there that Marianne described was it was a subsystem in a larger organization. And in that level, it felt like a very replicable process that had some very wonderful bottom-up elements to it. I mean, one of it was just, observing the practice and seeing what can be changed, where are people ergonomically screwing up on a regular basis. Probably all throughout the system, people are doing something like that. And then going to people there to ask for design changes and coming up with great little design changes. So it was really manifesting a lot of the content from this morning. And then on top of that, delivering them the self-care that can go with the systemic change. So you've got the self-care elements and you've got systemic elements inside of one little small subset of the larger system. That process seems quite replicable,
I love it. I totally agree. Dr. Sheik, I might turn to you for in your session. I think it was from Diana, I heard about health workers who are delivering 800 babies per month. It's about 25 a day, often with only 3 hours of light from Diana, under very difficult circumstances and sometimes being blamed. Can you give us some headlines or updates from your session? Also, I want to ask Diana and Ron to also comment as well.
Thanks, Sandeep. In our session, I must say I was personally blown away with remarkable examples of human ingenuity. This were two people, Diana working in Malawi and Ron working in Uganda. Minimal resources, incredible number of people in need of mental health interventions. And they have, with help from the board of certified counselors, trained hundreds of lay people as counselors themselves, and somehow or other prevented burnout both in the counselors and themselves. In Malawi, because there has been an epidemic of AIDS, you have really the middle generation disappear over the last several years. So you have kids and then elderly, many of whom are demented. So Diana and her counseling team works with them somehow, I don't know how, they have come up with a system whereby they provide this kind of counseling, still keeping confidentiality by taking walks with people who want to speak to the counselors, and they keep it going. And when you ask them, how do you keep your sanity and how do you not burn out yourself? And they tell you that the passion that they feel because they think they are doing something good, and at the same time, of course, they get a lot of support from their own families or getting involved in activities, like Ron was saying that he does a lot of gardening. So you look at this and you admire what they have achieved, and then you look at your own situation and you recognize that actually, in some ways, having excessive resources can be a curse because you do not fully depend on your own ingenuity. So I'll stop there. Thank you.
Patricia, I see we're at time, but are we allowed to go for a minute or too long? Okay, perfect. So Diana and Ron, you've come all the way from Malawi and Uganda, and we are so grateful that you're here. Do you just want to share just a little bit about your experience?
Yes.
Briefly.
It's my first time to be in America, and I'm so empowered and so excited
And
to be here in this very high-level meeting. On my example that he was referring to on the health workers that we interact with as helpers in the community. I'm not a health professional, but I interact with health workers, victim support service workers in the police unit, and other community leaders because of the work of counseling that I do. So this health worker indeed, in the rural setting that I'm coming from, we thought she was so stressed with the work that she do. She was tending to 50,000 community people. 50,000 people in this community, and delivering babies of an average of 800 per month. Indeed, it's a very large community which lack resources. And I was just talking to him the story of what happened to this health worker in a place where we do not have electricity and also potable water in this community. And she was using her phone, the small cell phone, to check of when she was delivering this baby. And then, unfortunately, as she was increasing the passage of the baby to come out, and blood came out of the baby. And the community was angry. And this is a health worker who is using all her personal initiative, her skill, and her being called from out of retirement at 75, and she was so helpless. Mm-hmm. And through suffrage, she continues to do her work in the community. And we thought there's a gap. They need to be helped, those type of people that are in the communities doing their work, but then helpless when it comes to issues that they encounter while doing their work. Thank you.
Thank you. And Ron, briefly, and it's your first time here in the States as well, correct?
No.
Oh, no. Okay, good. All right.
Yeah, I went to school here, and I had the privilege of meeting Dr. Wendy Schweiger when I had gone for SCCA conference. At that time, I was preparing to go back to Uganda, to a very low, limited resource area where there was no food, no water, no medical care whatsoever, and no education in this entire community. A person died a day because of what was happening. And all that was causing a lot of stress to everyone in the community. Because of collaborations like with NBCC, first aid counseling, training, for a program called mental health facilitation was taught to members of peer influence in the community. And that made a change. I remember because of no medical facility at all and people dying every day, one of the things that we had to do was to reach out to the community through a mobile clinic where medical workers, and I'm talking about nurses, would go to communities and treat the people there. They were stressed because of the number of patients they were meeting on a day-to-day basis. But more so, they were stressed because of the death that was going to happen if they had not got an opportunity to treat that patient. And so, one of the things that came out of the treatment, many people were not feeling well, not because they were physically sick, but because they were mentally not well, losing their loved ones, not having what to eat, living on a day-to-day basis, being very hopeless. But with the training of members of influence in the community, slowly by slowly, people have gained hope. They are beginning to feel heard, and the living condition is improving. And so being here today, learning and listening to our system design can help to elevate this problem. Is very empowering, and I thank you. I'll take this to the remote communities in the areas that I serve.
So I think we've just heard a little bit about the value proposition of the Global Forum. We've heard a global, we've heard a truly interprofessional, and we've heard this balance between the learner and education and practice. Is there, Patricia, should we move or is there time to go? I'm getting the eye to go. So Pinar's group, sorry we couldn't come to you. Hopefully we'll get to revisit it. I just want to say thank you. We sort of heard from Lizzie about Failure Fridays. I propose before Failure Fridays that we have Thankful Thursday. And I just say thank you for engaging this. Thank you for being here. Thank you for building this movement. There's definitely something in the air here when I look around this room, especially when I walked into room 3 and saw what I saw. And just, I thank you for taking this forward. So, bye.